Hello,
Hello,
Tammy.
everyone.
Hello, everyone.
Hello, Dr. Cook. How are you?
I am good, thank you.
Good. Well, hey, here we are. It's the third week of the month, and we have a great Q&A session today for you.
I know we have great questions. We have
Yeah.
smart people. It's fun to get questions.
All right, let me pull up the PowerPoint here and we can get started. Can you see that, Dr. Cook? We're good?
Yep, you've done it right.
Okay. All right, let's start into it. Here is our first question. Is it possible to run a custom InfoBoost and a preset InfoBoost at the same time?
Yes. Next question.
Okay.
No, it is. You can run more than one info boost. And when you create the info boost, that's when you make the choice. Is it going to be a custom or a preset? And if you start two info boosts within a 24-hour period, then Limbic Arc is going to well, let me back up. You don't have to do a spark to use a preset. So you could turn on a preset and then create a spark and use that for your custom. So, but the answer is yes, you can.
Okay. When an info boost ends, do the results stop all at once or fade gradually?
Well, the results, meaning when you turn the info boost off, does the information that's being put into the field stop? The answer to that is yes, that happens all at once. But does the effect uh, diminish or go away? And the answer is no. If it's like if I was learning to speak a foreign language and I studied it and studied it, well, if I stop studying, do I forget the language? And the answer is no. What I've learned stays with me. Same is true with limbic arc, only the information is absorbed and utilized at a subconscious level, but it still persists after I've incorporated it.
Okay, that's a great example. All right, moving on here. If a boost ingredient scores below 80% or 70%, is it still worth including in an info boost, or should I focus on higher scoring ingredients?
Well, I focus on higher scoring ingredients, but that doesn't mean that that's the only way to do it. uh, there are times, for example, let's say that you know something about vitamins or about homeopathic remedies, and you have a particular condition or a particular situation you want to deal with, and you know that this homeopathic remedy will help or is known to help that. And let's say you run the Spark scan and it scores 60%. Well, you can still use it because you're making the choice based on your knowledge, not necessarily based on the biometric sorting of the library. And so uh, don't think that there's not a hard and fast rule of how you use limbic arc. If you're just using it in a quick and dirty way, which is what I use it as mostly, Cami, is
Mhm.
I'll just select usually down to 90%. That's where I stop. But I just turned on an info boost this morning, and after looking at what was there, I stopped at 95%. So
Okay.
again, there's no hard and fast rule. And if you want to go below 70%, uh, give it a try, see how it's
Yeah.
doing for you.
Okay. Is there a limit to how many info boosts I can run at the same time?
I don't know. The number five comes to my mind, but I'm not sure that that's true. I tend not to run a lot because uh, I think you can get too much of a good thing. So you might have, let's say you were going to run five info boosts all at the same time. Well, if you take the cumulative number of boost ingredients that you're outputting, it may be a fairly large number. But I don't think there's a limit, although there may be. We may have said five is enough, seems to be enough, but I've never pushed the envelope on it, so I'm not sure.
Okay. Can you recommend an InfoBoost that supports healthy gene expression, cellular function, or muscle health for someone with LGMD, which is limb girdle muscular dystrophy?
Remember, Limbic Arc is not a medical device, and so we don't diagnose or treat medical conditions. But let's talk about this for a minute. Limb girdle muscular dystrophy can affect anybody at any age, and it's characterized by a weakening of muscles in the pelvic area and around the shoulder girdle. So, and sometimes it can affect swallowing or cardiovascular health or lung health even. The belief is that the cause is multiple genetic anomalies. So you may have a number of SNPs, is what they're called, which stands for single nucleotide polymorphism. But I would look to things that may cause muscle health. There are nutritional supplements that will help your muscles not atrophy. That would be helpful. There are things that will contribute to the health of the mitochondria. That information might be helpful. And there are some, most SNPs, let me put it this way, most SNPs can be supported or addressed or helped, and sometimes even corrected with the right nutritional supplements or natural ingredients. And I don't know what all those are, but I do go to some seminars, and there's some pretty smart doctors that get up and talk about, oh, for this SNP, you do this, and for that SNP, you do that. So I would say anything that comes up in a custom InfoBoost, I would use. And if you do any research and you see something that resonates, then I'd load that into your InfoBoost as well. So, but again, we're not a medical device. We will be a research device fairly soon, and so we will address more medical approaches. But in the meantime, our focus is on quality of life. This certainly would affect the quality of your life.
Right. Great advice. Can I run an InfoBoost to support another person in my household?
Uh, well, yeah, the answer is yes. First of all, friends and family would be the first way to do that. You could set up a friends and family account for that person and then have them run the InfoBoost. The other way, let me just give you an example. Let's say that you're living with your older child who is driving you crazy. And, when kids get older, they are adults, and adults don't like to be supervised. But if they're living in your home, you want them to live with your rules. And that sometimes creates conflict. Well, if that was the case, so this is my hypothetical example here, Cami.
All right.
Then I would do an info boost, and I do a custom one, and I would talk about my relationship with my child. Bill's driving me crazy. He wants to come and go as he pleases, and so now what I'm doing is I'm creating an info boost for me, and because of my relationship and my field relationship with my child, whatever shift occurs in me will have a spillover effect on them. Now, I can't make my child or make anybody in my house do something. You can't override someone's agency, but you can affect your own choices and your own decisions to respond. And it's perhaps what Bill is doing, since how that's the name I gave this child. Uh, what Bill is doing is bugging you, but it may not be bugging him. And so if you can just stop being bugged, that's going to change a lot. And so if you'll do an info boost and you'll talk about what's bothering you, then you activate that with the expectation that you're going to change, and then just observe how that changes the relationship between the two of you. So that's how I would approach it. It would either be a friends and family, or I'd change me to affect the relationship.
Yeah, love that. I would like some help from Limbic Arc to experience a new romantic relationship. I have been single for over 10 years.
Great question. I mean, a great wonderment. Um, hmm. Well, the answer is yes, you can do it. I mean, relationship is one of the five domains, and romance is an important part of that. We all want to love, and we all want to be loved. Uh, I would probably just focus on that desire. I would set the intent when I do the spark. Um, I want to be open for romance. I want to, if there's some glitch in my personality that tends to drive women away, then, or men away, in Susanna's case, I'd like to change that and see. I might not even be aware of what it is that makes romance difficult for me. But and then the other thing is, don't be too hard on yourself. You know, that's a
That's so true.
yeah. It's I don't think people who live single lives are they don't remain single for bad reasons. So it's sometimes it's just circumstance.
Right.
And but yes, I would say use Limbic Arc to help improve your love life.
Can Limbic Arc web app help with weight gain, not just weight loss?
Yes. Yeah, and that's the beauty of information. Information will correct things that might be uh, causing your body to operate suboptimally. And an inability to gain weight can be as problematic as the inability to lose weight. Now, most of us don't have that problem, and most of us say, "Oh gosh, I wish I did." But the answer is yes. You can. Um, Again, I want to be careful that I don't overspeak here. Uh, the right information at the right time will help your body to move into a position of greater coherence. And that position of greater coherence is a balanced position. And as that happens, you will then normalize in a more optimal way, which you could call a more healthy way. And if what you're lacking in your coherent pattern is the ability to gain weight, then I would expect that Limbic Arc could help with that, just like I think it can help with the other side of that coin.
Right. Okay.
We're moving right through these.
Hey, we are. Okay, here's one about migraines. I've experienced migraines for many years and have tried various approaches without lasting improvement. Do you have any recommendations?
Well, migraines, I know they're tough from a clinical point of view. Um, My experience is if somebody's getting a migraine and you can treat it fast, it usually doesn't turn into a migraine. Uh, when it does, then it becomes more difficult. And if you're a chronic migraine sufferer, that becomes more problematic. Um, I'm thinking of the last patient I had with migraines who I still occasionally treat. Um, she has found acupuncture to be effective. We've done injection therapy on her.
Mhm.
Um, she has done with a neurologist she sees, they've done Botox injections. That has helped. One of the big things that has helped her has been cranial therapy. So you might find somebody who does cranial therapy. That's a form of massage, but they focus on your head and they adjust your head in very subtle ways, and it changes the flow of fluid and energy through your head. Um, Diet can be an issue, so I would certainly pay attention to when I do a spark scan. I would pay attention to the food, and when you do that, I would scroll to the bottom of the list to the most negative ones, and then take the three or four most negative and avoid those foods for a week or two and just see if that helps. And then I would repeat that. And if the same food or foods start showing up in that bottom section, you'll know that, oh, this is a food that I should avoid completely. I've probably told the story of how I learned to avoid chocolate, much to my chagrin. But but it was because it kept showing up at the bottom, and I don't eat chocolate anymore. So that could help. So I'm a great believer in whatever works, and if somebody needs drugs, then they need drugs. If somebody needs surgery, they need surgery. Um, I'm also a great believer in doing the least invasive first and then moving towards the more invasive over time. I wouldn't jump right to the most invasive. And limbic arc is certainly in the continuum of health. It's one of the least invasive because this is information that comes to your body. Your body then uses it however it can, and sometimes that's enough. Sometimes it's just the next step that leads you to what you need. But in all these conditions, including migraines, I would just keep myself open and try different things, and you'll probably get to the results. That this woman I was telling you about, her symptoms came on fairly abruptly, but she's dealt with it for about 3 years, and she's actually almost fully functional again, but she's the worst migraine sufferer I've ever seen. But she tried a lot of things and they all helped.
Yeah. Great suggestions. Thank you. Which info boost should I run first when addressing more than one wellness area?
Great question. I think that the let's see, is it the five element, male and female, or is it the male and female? I can't remember the name of it, but it was put together by some very brilliant people there in Europe. I think they're in Hungary, and I forget their names. I'm sorry, but it's a terrific couple of terrific info boosts. So you might start there, and the way that they recommend you use those uh, is you go down to 70%. So you run the Spark scan, then you take everything above 70%, and that's what you put into the first info boost. You may also start with something that has more to do with drainage, so like a liver or a lymphatic. Um, but those are the two that I think come to mind if you're just looking for, how do I get started? That's not a bad place to start.
All right. Do the people in my friends and family program have access to the same features I do?
They do. Yeah, whatever you subscribe to, when you turn on our friends and family account, they inherit the benefit of your subscription.
Okay. I had a stroke 5 years ago and still experience thalamic pain. I have been using InfoBoost for nearly 3 months with the guidance of my mentor. Do you have any recommendations regarding my settings?
Um, Thalamic pain, that's usually the result of a stroke. There can be other reasons, but that's the most common. The thalamus is an organ that acts as kind of a gatekeeper for sensory input. In other words, your senses like touch and pressure and temperature, that stimulus goes to the thalamus and then it's transferred from there to the higher level, higher brain levels. And in the higher brain, that's where it's translated. And normally that's not a painful experience, but if your thalamus is damaged, then those signals get distorted in a way that when they reach the brain, they're interpreted as pain. And so you could approach it from a couple of ways. One is I'm going to approach this as just trying to correct the damage to the thalamus. Or you might say, I'm going to approach this as learning a new language, and the signals coming from my thalamus will not be interpreted as pain anymore. And so I think you could, if you took both of those approaches or one or the other and experiment with it, then again, I would use, I'd probably do a little research to see, what does the thalamus need to be healthy? And I'd use those supplements or whatever comes up. Then I would expand that, and I would, if I'm approaching this from thalamus health, then I would talk about I want to improve the health of my thalamus, repair the damage that was done during the stroke, or compensate for it. And then the other would be I want my brain to get smarter and not see these signals as pain signals. I'd like them to see it as normal inputs, like it was before I had my stroke. So, and that's
Right.
really, I mean, that would be the approach I would take.
Okay, great advice. Would it be possible to add asbestos to the boost ingredients in the future? I believe it could be a valuable addition.
Great suggestion. The answer is yes. And let me say that any suggestions anybody has for new library items, if you send that to, is it success at Limbic Arc or is it
Correct.
info
It's
or ask
success.
Dr. Cook? Success. So send that to success at Limbic Arc and it gets on a list. And I've mentioned before in a few previous calls that we're working right now to expand our library substantially as part of this research phase that we're creating and becoming a part of. So thanks for this suggestion.
Yeah, and the more I think about this one should actually go to suggestions at limbicarc.com.
Oh, okay. Okay. Thanks, Cami.
So we have that, yeah. And but I will make a note of this one. All right. My last lab test showed an elevated hemoglobin, HGB level. Do you have any recommendations for InfoBoost settings, categories, or signals to consider?
Um, well, higher hemoglobin levels, the reason you get that is because your body wants more oxygen. And so it creates more hemoglobin, and that's the blood cell that carries oxygen. So normally, the solution to this is just drink more, hydrate yourself more. Um, Let me rattle down a few more ways you deal with it. Another way is you take some blood out of your body. So you go see a phlebotomist and they pull a unit of blood out. And what that does is it reduces the volume of blood so that the increased hemoglobin becomes less threatening to you. Um, Another reason that you might have this would be sleep apnea. So if you're not getting enough oxygen while you're asleep, then your body will build more hemoglobin to try to compensate for that. So look into sleep apnea, and you may not have it. You may not even be aware that you have it, but one of the indications is you wake up tired, or if you're snoring a lot, that's another one. But so you may need to get a breathing machine that you wear when you're sleeping. Um, so what InfoBoost would I use? I would probably look at the blood InfoBoost, and I might do a customize it so it sorts it. Otherwise, it's hard to know what to use because there's lots of stuff in there that has something to do with blood. Um, you could also talk about oxygen. You could talk about reducing the hemoglobin level. Yeah, Maria's probably not on testosterone therapy, but men who inject testosterone, if you inject too much, it actually will create a hemoglobin problem. So um, if if any men listening have this same problem and they're on testosterone therapy, they may want to look at their dose. Um, but blood and do a custom. Uh, and of course, the custom, you can always talk about hemoglobin and it'll help sort that library and just take the top items. That's another way to do it. And just stay hydrated. That's really the first thing you want to do with this.
Okay, thank you. During my last Spark scan, I wondered what effect selecting the all option would have for all ingredients or for a specific ingredient category.
Well, if you select all, that just means you're going to turn, in the case of all ingredients, it means you're going to turn everything in the library on all at once. And I think that's a little bit too much. Now, I'm sure somebody has tried it. I never have. But I kind of don't see the point of it for this reason. If if I have a question, I want my question answered. I don't want to know everything about what went into that question, if that makes sense.
Yes.
Um, it reminds me of a joke. This kid came to his mother and said, "Mom," and then he asked her a question, and his mom said, "Well, why don't you go ask your dad?" And the kid said, "I don't want to know that much." The dad was just over complicating things by giving too much detail to the answer. The kid just wanted the quick answer. I think sometimes our bodies just want a quick answer, and so you don't have to overload it with all the information. Just give it, what the top priority is.
Right.
But that would be the effect. The effect is when you select all, it just would turn on all ingredients when you activated the info boost. The same thing with any category. If you select everything in the category, just turns on all that information at once.
Okay. Does the duration of an info boost affect how strong the results are?
Um, well, no and yes. The answer is no because if the information is being put into your field, the duration doesn't make it put into your field with any more horsepower. It's not coming in faster or harder or, with more volume. It's there. So as long as your info boost is active, the information is in your field. Now, when you turn the info boost off, what happens? Well, to the extent that your body has taken that information and made adaptations as a result of it, that will be a perpetual change. Um, but sometimes you have to study longer before you learn the topic. And sometimes you need an info boost to be on longer in order for your body to make the adjustments permanent. And I would expect sometimes you even would turn an info boost on more than once. You know, in well, let me go back. Let me use two examples. One is the example of learning a language. If I learn Spanish and somebody says, "Oh yeah," I'd say "Hola," that means hello. Okay, I'm done. You know, that's all I wanted to know is just how to say hello to my Spanish or my Mexican friends. And but if I study longer, then I'm going to learn more words and I'm going to be more fluent in that language. So that could be like the info boost is on for just a minute. Okay, you get an hola info boost, or you leave it on for longer and you get a, como está info boost. That's one example. The other example is in homeopathy, there is a metaphor that healing is like peeling an onion. And what you see as a practitioner when a patient presents with symptoms, you're seeing the outer shell of the onion. And so you treat that and it peels that shell of the onion off and you get a little bit deeper. You peel that and it gets a little bit deeper. Well, based on that metaphor and that concept, an info boost, you might say, I want more romance in my life. And so you turn on a romance info boost and you say, well, I'm going to leave it on for 14 days because I want to fall in love within 14 days. And it may not happen because you may have to peel a layer of the onion to get a little bit deeper. And so what happens in the 14 days is something good, but you don't fall in love. And so then you come back and you do another info boost, and it's going to be different because your voice energy changes because you've changed. And so you're peeling that onion and you persist until you get what you're after, um, or until, you learn what you need to do to get what you're after.
Yeah, great examples. My goodness, that's our last question for today.
Those
Those
were
are
fun
great.
ones.
Yeah, yeah. Now, just a reminder to everyone, if you have a question that you'd like us to address next month, send that to Ask Dr. Cook at limbicarc.com and we'll get it on the slide deck for next month. Yeah.
All right.
Thank you for joining us today. It's good to see
Thanks,
all of you.
everybody. It's great to be here, and we'll see you soon.
Bye-bye.